Good afternoon, everyone. It's my pleasure to welcome you all to the first virtual counselors conclave titled Care, Compassion, and Communication Shaping the Landscape of Wellbeing in Schools. I'm delighted to see so many dedicated school counselors, wellness teachers, and school leaders joining us today. We have already crossed the 1000 mark, which is the limit that we have at our WebEx medium from where we are hosting. And y'all are there from all parts of the country. And I think even I can see a lot of counselors and wellness teachers joining from abroad. So thank you so much for such an overwhelming response. It's a privilege that we would be having our secretary, Shri Manshu Gupta, joining us soon. And it is his guiding force in all our endeavors that really motivates us and makes us do things that we are trying to plan out vis-a-vis the counseling and wellness of the school fraternity is concerned. A special welcome to all our panelists who would walk us through the sessions. Today's conclave is a part of CBSE's broader initiative to support the professional development of school counselors, wellness teachers, and everyone across the nation. Over the past months, we have been conducting a lot of capacity building workshops, and we have already completed 10 of them, starting from Lucknow, then Delhi, then Gurgaon, Jaipur, Mumbai, Kolkata, Hyderabad, Chennai, Guwahati. And we've just completed the Hyderabad leg of our counseling workshops, or you can say the CBPs. We still have to go to Jammu and Bangalore and Kochi. So these are the areas that we would be covering in the next, few days, so as to say, before the end of the September. These programs, structured in hub and spoke model, are designed to align with the recommendations of the National Education Policy 2020, focusing on the comprehensive development of our young learners. The Counselors Conclave, initiated by our lead collaborator, Dr. Javed Alam, Principal Lucknow Public Collegiate, is an extension of this initiative, and we plan to have a series of such conclaves in the months ahead. As we embark on this journey together, I encourage all of you to engage actively, share your insights, and take full advantage of the opportunity to learn from one another. You can always reach out to us through a chat. We have opened up the chat for you. We would be taking up the queries, the suggestions, and everything that you put across to us with our panelists through your chat. So please be interactive, and we'll be looking forward to your suggestions and your queries and your inputs. Remember, your role is crucial in shaping the future of the students, and through initiatives like these, we can collectively make a significant impact. Thank you so much. And over to you, our moderator of the day, uh, Dr. Nagpal. He doesn't need an introduction. So, Dr. Nagpal, over to you. And thank you so much, all of you, for being here today in this virtual platform. Thank you so much.
From the paradigm shift of counselors to the counseling systems in our country, and how we look at the ambience of happiness, health, and harmony on the campus of a school where every child matters and no child is left behind. And with the NEP 2020 coming in, the whole emphasis on socio-emotional learnings is not at all far behind. It is right here. So we are so happy that we have over 1,000 members join today, and there are so many of them still wanting to join. And this will be a great movement forward. Counselors, counseling systems, our honorable teachers, principals, and families and peer educators, all coming together as stakeholders, shall create a skyline for the new understanding of children for tomorrow. So, with these words, we are waiting for Niti Shankar ma'am and Honorable Secretary sir here. Meanwhile, I'll take the privilege to invite and mention the significance of contribution made by our honorable panel team here. Professor Nishant Goyal has been a great researcher, a great clinician in the country at the Central Institute of Psychiatry at Kanke, Ranchi. And sir has more than about 100 research papers on current needs and current understanding of children and adolescents across India, as well as multinational, multicentric studies. We have with us Dr. Asta Sharma with us. She's a prominent, renowned clinical psychologist, looking at school mental health programs in the area of Lucknow and neighborhood. And she has been very active working as a master trainer also for many of the programs concerning peer educators. And she's also devised a few of the activities which are important for expressive art therapy, integrating arts with mental health and well-being, including exploration of Indian classical dance like Kathak. Thank you, Asta ma'am. Poonam ji, you are, it's a great privilege and honor to have you today with us, a very renowned educationist across the country. She has contributed to many, many platforms of, I would say, rejuvenation and relearning about how it matters to connect and compassionately know children better. I'm sure with your experience and now being a trainer to so many organizations and being an important contributor to the school ethos, your presence here will offer the essence of the main theme of this program. So with the words of what Neeti ma'am and Javed sir told us, we'll move on to the panel. All of you kindly do come out from the heart, not just the mind. And today matters a lot because you are on a consensus platform today. So Nishant sir, let's begin with you.
Sure.
What is in your mind when you look at care, compassion, and communication? The sub theme of today's launch session of the Counselors Conclave. What does come to your mind, and where is India looking at the mental health of children and adolescents, both in the field of education and the growth and development in the health sector also? Give us a little overview, then we'll come to the next.
Thank you, Nagpal sir, and thank you, CBSC, Niti ma'am, and everyone for having me. You ask about care, compassion, and communication, which is the theme. We have to care for each other with a compassionate way, and to do that, it is very, very important to communicate. So, this conclave is just a step towards communicating the need for mental health support, not only for all of us, but also for children who are the building block of our nation, as most of the people they have said. You have asked me to set up the context for the need for mental health support, particularly in young in our young population. So I just want to give you a brief overview that being part of National Mental Health Survey of 2015 and 16, which actually happened across the country, where more than 50,000 people were assessed at their home, mind it, at home. It was not a clinic based survey. And out of that, we also we randomly interviewed around 11,000 children and adolescents. And we found that mental health issues in this young population, that is between age 11 to 18 years, is around 7.3%, which is a huge number. And if you see that more than 30% of the population of the country is of children and adolescents. So we found that almost 100 million people were basically were in need for mental health support. So if you see from that, if you go back from this number, if you go, you just go back and see that why so many people they are in need for mental health support. So we have to see that school is one place, definitely, where a child spends most of his time of his initial part of the life. So if we are aware of and we are wary of the needs for understanding health, understanding the concept of stress, understanding the concept of well-being at the level of school or at the level of peers, it always helps a person to have a better childhood, a better school life, and a better understanding about how a person is growing in his life. So it is very, very important for all of counselors, teachers, educators to have the basic understanding of mental health being an integral part of health, which is the basic necessity of this time. Over to you, Nagpal sir.
A very important part you had raised, Dr. Nishant. Thank you for bringing in and factoring in the idea about the great amount of research India is doing now. And we are all sure we have a wonderful data we're all ready to embark, integrating and amalgamating the national education policy into the new classroom today. And if the NEP can be here, then can mental health be far behind? No. NMN and National Mental Health Survey, what does it tell us about the school mental health, and what does it help us to quickly devise at a macro level? What is the role of counselors? What is the role of those uh, professionals, those young people who are in the stage of joining schools in large numbers, in lakhs and lakhs, who want to become school counselors? What is your vision looking at the burden or maybe the need for school mental health programs? Just very briefly.
Yeah, sure. See, it is very, very important to understand that the burden of, I will not say the burden, the requirement of providing help and services to children is part and parcel of something which is known as universal level of prevention. So, if you understand the concept of prevention, now we talk about universal prevention, targeted prevention, so on and so forth. So, when we are targeting a child who has just joined school or who is going to school regularly, so if we are able to take care of the mental health need or mental health well-being of that child while the person is at school, it definitely helps the person to understand the needs of the time, the needs of the hour, how to handle, as Dr. Javed was talking about, life skills and all those things. So it is very, very important that we tap our children, we take care of our children at that particular point of time. So this is not about someone having a problem. So even if a person is not having a problem, it is
Absolutely.
always good
Right.
to talk about health, well-being, as well as mental health and mental well-being, maybe within the curriculum. I'm sure it is part and parcel of the NEP as you are talking about, as well as we ensure that this particular thing is being taken up and taken care of by various walks of people who are related, and they are with education. Over to you, sir.
Very true. I think while you're giving us a very broad view of the need analysis and how lakhs and lakhs of schools across the country, and now CBSE has taken the lead in bringing about a transformative learning with emotionality, with intellectuality, and overall participation in every activity as the hallmark of a schooling culture, a schooling flavor. But sir, now if I look at you as a person who is into a large amount of policy making for mental health, you've been part of the National Mental Health Program. They do talk about children, adolescents over there. But the fact that are we really having so much of manpower? I came to understand that for next about 100 years, we may not have a school counselor in every school of India beyond every state government, I'm saying. So when we do not have that much manpower, we need to have a flavor, an ambience, and a climate of counseling, isn't it? And that counselors today, whoever is in the school system, who are in the neighborhood system, we heard Niti ma'am just telling us, and Honorable Himanshu Gupta ji has been envisaging the hub and spoke model. One counselor can actually bring about a change in the neighborhood schools also by these programs, by advocacy, by awareness building, isn't it? So, meanwhile, till we get enough manpower in our country, it is very important to look at how you, as a policymaker in mental health, look at integrating the currently available manpower in bringing about a jump towards the hub and spoke model. Do you agree on that, sir?
Sir,
Nagpal sir, I'll just mention, I think
Yes, ma'am.
Himanshu sir has joined in. He's with
Thank you,
us.
ma'am.
So we can take him on the floor.
Very good afternoon, Imanshu, sir. We are privileged to have your kind presence here. Over to you, sir, for your address. We have just started the panel discussion with the idea about a macro approach to school counseling systems and how they matter a lot in creating the hub and spoke models in the country. May we have your few words of wisdom, sir? Himanshu, sir. I think there is a connectivity issue. Okay. We'll wait for you, sir. There seems to be a little difficulty in connectivity over here. Meanwhile, Nishant, sir, please go ahead. The need of the manpower for counseling and the availability of those resources. That is why hub and spoke models need to be bringing in a lot of, unlearning, relearning, so that we can reach out to the maximum nook and corner of the country.
Absolutely, sir. I completely agree with you on this. Who says that we do not have enough manpower? Our teachers, our parents. See, talking about health, talking about mental health well-being is not, you don't need, a specialist to do the job. So this brings me to the 5 T's of mental health education, particularly in schools. So these 5 T's stand for talking. So we talk about mental health. The second T is training, where we are providing proper training to our teachers and the school staff about health and mental health well-being. Then teaching, where we include mental health information in our teaching, providing helpful tools. Teach stand for tools to our students. They can use those tools like life skill education, curriculums. And finally, taking care of teachers. The last T is taking care of teachers. So if we are able to follow these 5 T's within our day-to-day functioning of school, we can definitely say that we can take care of this particular part of teaching and training mental health and mental health education in our school. Over to you, sir.
Thanks a lot, sir. That's opening the vistas of so much of new thinking. I think we all are compassionate about the fact that we have such a large number of children in our country and families, of course. And no doubt that our teachers, our education warriors, have done their best in the last 5 years to take education to every home during the COVID-19, and subsequently looking at the role of teacher as a first aid counselor. So the role of counselors is what is under the dialogue and discussion today. We will move on to. We'll come back to you, sir. We'll have a round and then come back to you once, Nishant, sir.
Sure.
And Asta ma'am, you have been listening to the conversation. Neeti ma'am started, and then we had Javed sir mentioning about the initiative being taken. Uh, you also have a very important case study to share with us today. But before that, what's your take on the discussion which you are hearing in a very brief manner, and then we look at your view on the case you're looking at today and the topic of today's discussion from the counselor's diary.
I would like to begin with by thanking you, sir, and CBSE Neeti ma'am, and all the panelists, because I think it's a very important discussion and dialogue that we are having today. Considering the stressful times that our children are living in, and post-COVID especially, I have seen an increase in mental health issues in children and adolescents. And that being said, I think the role of schools, and especially the counselors, teachers, and the people who are heading such important institutions, becomes all the more important, because children, they do spend a lot of time at school. And if the schools are aware and if they take timely steps and they move in the right direction, I think a lot of problems, they won't uh, increase at the clinical level. And that is what is needed at this hour. So I think this dialogue is extremely important, and such sensitive topics should be talked about. And because that is going to decrease the stigma also associated with the mental health issues in general. A lot of times we face this, where parents come up to us, or the teachers, they are very reluctant in sending children as in referrals, because they feel that the child will be labeled, the child will be stigmatized, and they do not want to do that. But actually the problem worsens. So I think it is very important that we all, as important members of a educated society, we contribute in this area, and we start destigmatizing the field by taking such initiatives often.
But Asta ma'am, that is a very important effort India is making, and I think we are much ahead in the acceptance and less of denial now post-COVID. And it is heartening to see that a lot of teenagers, adolescents who are taking the leadership role in schools, and with the very successful CBSE initiative started in 2021 as part of the larger counseling ethos for schools, the adolescent peer leadership program has actually lent a lot of destigmatization. The students, with the help
Absolutely.
of
Absolutely.
counselors, yeah, ma'am. What's your opinion on that? Because
Yes.
you've been working with many schools as an advisor in Lucknow.
Yes,
Yeah,
yes. No, I think that's a wonderful, initiative by CBSE, because these are important issues that should be talked about. And a lot of schools are taking initiatives in this direction. A lot of principals are coming forward, and they are understanding the relevance of, having a dialogue on these issues. And they are very forthcoming. They are making all the possible, taking all the possible measures in incorporating parents, their role, sensitizing teachers, and sensitizing students also at the same time.
exactly.
I think it's a great direction that we all are moving in as a country.
In fact, concurrent to your discourse, we see a lot of very, very positive comments on the chatbot. We have Ranjita Ranjan talking about talking, training, teaching tools, and we have a participant telling us about how seeking help has been considered as a taboo. Just to seek help, मुझे कोई मदद
Yes,
चाहिए, वो भी एक कलंक है. So कितना
yes.
important है this initiative for counselors as a conclave. Conclave means that we all come together. Thank you, Asta ma'am. We'd love to now look at the case history which you're going to share with us as a sub theme of today. And the Counselors Conclave looks at least one case study periodically. So let's have your take on this particular case you were trying to share with us. And what is the message behind this, ma'am?
Okay. So today I'm going to interest must have gone through seeing either such kind of cases or maybe similar cases on the lines of psychological distress that children or adolescents come up with. And are the slides visible to all of you?
Can it be on the full scale, ma'am? Yeah, it's coming through. We can see that. Uh,
Okay.
full
Okay.
screen में आ सकता है, ma'am? Yeah.
Let me
Okay.
see.
We can go ahead. Yeah.
Okay. Okay. So basically, today I have taken up a case which talks about not direct symptoms where children come up and tell you that, I am feeling sad, I am feeling angry, but a case where the child was unable to talk about her symptoms, and how, these kind of cases, they present a challenge to the, counselor within the school system, and also to the clinicians who deal with such kind of cases. Why is it important to talk about these cases or children in general? Because children are the most vulnerable population, you know. So they are vulnerable to any kind of abuse, exploitation, violence, and most importantly, most of them, they are unable to communicate what they are going through. And because they spend a great deal of time at school, schools can play a great role in identifying these kind of symptoms early on, so that timely referrals can take place. Now, children, as we all know, because we all work in this field, they have a world of their own. They have their own perceptions about people at large. They have their own beliefs about how the world should function, how the teachers should behave, how my parents should talk, how I should not be forced to do certain things. So they have their own belief system, and they have their own perceptions. They have their own inner world to which they retire into once they start to feel that the people out there are not understanding them. They are not understanding what they are going through. So it is very important that we pay attention to even non-verbal cues that children are exhibiting in front of us, whether consciously or not consciously. Because, see, we need to remember that behavior is the language of trauma. The children, before they start to tell us anything, they start to show that they are not okay. So we need to be very, very aware and quick to observe these little changes in their daily routine, in their daily mannerisms and behaviors, so that we can reach out to them if they are not able to reach out to us. Now, here's a case study that I would like to, talk about. So this is a girl. This is about a girl, 17-year-old, who was studying in class 11th, and she was brought to us in the OPD with symptoms of recurrent episodes of continuous vomiting for past 2 months. And mother also reported here intermittent episodes of stomach pain, abdominal discomfort, along with mood related issues, which were accompanied by sadness and easy irritability. It was also characterized by 3 to 4 episodes in a day of vomiting, where nothing substantial would come out, and it was also minimal in quantity, around about 1 tablespoon, which was watery in consistency, containing ingested food particles predominantly, and saliva. And it would happen after the child would have eaten something or would have drank something. Now, when
Asta ma'am, one request. Can you just rearrange your screen? There is a patch on the, if you can see it yourself, there's a patch which is hiding away some of the matter on the slide. Can you
yeah, just let me see how to move it. Okay, is that fine now?
Still there, ma'am?
Ma'am, just do full screen. Like you have to do
It's
slideshow.
okay now. It's okay
Slide
now.
show. Just a moment. Yeah, I'm not very good with.
Ma'am, just press slideshow on the right side, so it'll take us the full slide.
Uh, where is it exactly? Oh, I don't know how to do it.
Ma'am, nearby animation, there is an icon slideshow. If you will click that, then you will have the full screen mode.
Right, Asta ma'am, proceed now. Don't worry. We are able to see it a little. Yeah, perfect.
Is that fine?
Yes.
Okay. I don't know what to do with this box that is coming in between. I'm so sorry. I can't.
Go ahead, ma'am. Yeah, yeah.
Okay. So
Can we have a look at the previous slide once quickly? Because some of us were not able to. Yes.
okay.
Okay. Excellent. Right.
Can we go ahead, sir?
Yes, ma'am.
Okay. So when we took history of this girl, their history was not suggestive of any food allergy or motion sickness, which we are, supposed to rule out, because many a times uh, the patient can have allergy to any particular food items, which may induce vomiting or nausea. So in history, it was ruled out that the child did not have any such history. Also, there were no signs of pubertal premenstrual cycle exacerbation. These things are also important to be ruled out, which is the work of the primary clinician who's dealing with the child. Also, the cycles were normal. When we are dealing with female clients, it is important to talk about the menstruation history, the cycles, because they also play a role in overall pathology. Now, in the history, when we were eliciting history, it came out that the child actually started, sensing some difficulty in understanding business studies subject, And that is when she started to have some sort of anxiety. And in spite of devoting a lot of effort and time to the study of the subject, she was not able to score well, and which started impacting her exam performance. This actually coincided with her symptom onset, that is, when the symptoms actually started to begin. She also revealed of having no close friends, parents also going through separation. It was a very, very emotionally turbulent time for the girl, and she was not allowed to pursue dancing, which she loved, as an activity. So, in a nutshell, what we are trying to look at is the symptomatology. What is it suggesting? That there were few significant stressors in the girl's life, because of which she was psychologically disturbed. But why was she, showing signs of physical problems in terms of feeling nauseated or having vomiting episodes? Because that vomiting, strictly speaking, is a physical symptom. So her symptoms actually were a cry for help. And in our field, it is seen a lot of times that psychosomatic problems, they appear in children and adolescents. Why? Because many a times they are not able to express in words what they are going through. And because soma, which means body, is interconnected with mind, so when the mind is not feeling okay, it is not able to bear the pressure, it actually goes for a toss, and the body starts to communicate on behalf of the mind that I am not feeling okay. Okay. So what is next is, just a moment. So she was diagnosed with psychogenic vomiting. That is vomiting episodes happening because of the psychosomatic reasons, that the reasons were not biological. Organically, everything was all right. And she was going through, some sort of distress and stress, because of which she was going through this condition. Now, it occurs as an emotional disturbance and it can affect all age groups. Mind you, it is not only restricted to children or, adolescent age group. Many times in adult population also, we can see this kind of a problem occurring. When we are encountering this kind of a problem, what is important is taking adequate history, ruling out any current or past significant stressors in the child's life, which may have impacted her soma or body in a significant manner. It is also important to understand what are the possible antecedent conditions which could have caused this condition, like any other manifestations, the time of the day at which this particular episode occurs most frequently, what is the total duration of the episode, how frequently the episodes are occurring, and is the child not able to communicate or verbalize what's going on. In this case, it was very evident the child had emotional trauma where she was seeing the parents going through a separation phase. She was not able to have her creative outlet in the form of having dance classes because she loved to dance. But due to whatever reasons, she was not allowed to go for dance class. At the same time, there was an academic problem going on where she was facing this difficulty, and there was absolutely, no understanding at the initial stages about her difficulty. Um, Now, this psychogenic vomiting can be of various types: habitual, postprandial, that is after ingestion of food, irregular, continuous, and self induced. Self induced, wherein the patient tries to induce vomiting by either, putting a finger inside or, trying to induce it in some sort of artificial manner. Most of the times, it is associated with some other psychological problem, and it can be secondary to either a depressive episode going on or some sort of other neurological conversion. Conversion problem is where a neurological symptom is present, but it has no organic basis as such. So, the hands not moving, I'm not able to speak, sometimes symptoms mimicking paralytic attacks also in some very severe forms of cases. So all these problems actually, if the organicity is ruled out, they indicate some underlying psychological problem.
Pastor ma'am, this is a very important turning point in understanding how trauma can be, you know, put across into so many forms. And trauma can be mild, moderate, or severe. And such psychological turning points in life of a child are so crucial for teachers to help the counselors know better and counselors to help the parents know better. So we would certainly look at your perspective on the key messages. Yeah.
Yes, absolutely, sir. I think many times what we do is that we try to, put these symptoms under the carpet by saying that, the child is faking these symptoms. She's trying to avoid coming to school. She's not, she's not coping well. And we try to, stigmatize sometimes. But in this particular case, it was very, very evident that the school did a wonderful job because the counselor was, quite aware about the possibility of psychosomatic problems the child might be going through. And there was timely addressal and adequate referrals were made and adequate action was taken, which I'm going to emphasize as we move on in the session. Now, it is very important to quickly highlight some short-term benefits which the patient receives when the patient is going through these kind of symptoms. And mind you, they are not consciously done to fake, but the patient, as a consequence, receives these kind of benefits. Once the similar episode of recurrent vomiting in childhood acted as a reinforcer. So when I was eliciting history, it came out that once, the child had not prepared for the exam and she vomited and she was not allowed to, go to school, and that's how she could skip the exam. And so it was some sort of, a reinforcer, a positive thing for her where she could escape the negative consequences of appearing for the exam. And that is how, vomiting or nausea or abdominal discomfort became sort of a learned behavior to escape or to avoid an unpleasant stimulus. So because we are talking about psyche, we need to understand these, wrongful associations which develop over a period of time based on past experiences. Then also to help herself from unresolved psychological conflict, she expressed physical symptoms of recurrent vomiting. And because expressing that I'm having problem with this particular subject despite putting in effort and time and everything, it is anxiety producing. It is very difficult to accept that I'm doing everything and still I'm not able to score marks. So she unconsciously adopted this mechanism where it was kind of a socially acceptable behavior that, okay, I'm not well, so it is okay if I'm not performing well. It is okay if I'm skipping school. So, kind of attention that I'm getting, the kind of support that I'm getting from the teachers, the parents, everybody, the care, I'm liking that. So the psychosomatic problems always have secondary benefits of these sort, where attention, care, avoidance from responsibility, sympathy, they come as added advantages, which actually maintain this kind of a pathological state for some time. So it is important that we understand what happens, when the child is going through this condition. So what actually is somatization? So this was in short the history. Somatization, as I have talked about, it is related to soma. Soma means body. So when your body starts to do the talking for your mind, emotional distress, when it starts to come out in the form of physical distress, then we say that it is some sort of somatization that is taking place. Now, it can happen because of many factors. It could be due to poor nutritional intake, disturbed sleep patterns, high levels of stress and anxiety, unresolved conflicts, many, many symptoms. And when negative mood state is accompanied by it and it is not getting adequate intervention, the symptoms or the episodes may worsen. Physical symptoms very common in children. Almost 10% children, they report some sort of pain or worry per day. Yesterday only, there was a child, a 6-year-old girl came to me with similar symptoms of feeling nausea and vomiting, avoiding school because of certain, stressor at school. So it is very, very common. We may miss but it is commonly present in children and adolescents. And it is very important to remember that these symptoms are biological in nature, and the child is not faking them. That faking is a separate category altogether. But most of these children who are having these kind of somatic problems, they are actually going through these issues. And they may feel extremely distressed about these problems, which may start to interfere in their day-to-day function.
So, Asta ma'am, I'll just interrupt you here.
Yes.
There's no doubt that somatization and somatic symptoms and patterns of physical um, complex group of symptoms is not uncommon, and it has never been uncommon. We have seen an exaggeration or escalation of this in the last about 2, 3 years. I'll bring in Poonamji here as a educationist, and we'll come back to you for a moment regarding a brief outline of the management of such cases. Poonamji, you've heard the case, you've heard about how the little children in the junior school in the foundational years can develop a sense of helplessness, and that low self-worth somewhere takes on the acceptance in the family or the peers in terms of projecting physical symptoms. And probably many of us have gone through this in childhood, and we see a lot today. As an educationist and as a close observer of families and children for so many decades, what did strike you? What struck you when you were hearing this case in terms of commonality and in terms of what would you do as a school head when you find that these are things not uncommon today?
Yes, good afternoon, sir, and thank you so much for having me on this panel. I think while Asthaji was speaking, I could completely relate with what she was saying, but I would like to start with the theme of this, conclave today for the counselors. We say shaping the landscape of well-being in schools, and I think all of us will agree that the landscape of education, the landscape of society today as it exists, has undergone a sea change. You know, when children, the world they are living in today is very different from what it was even 10 years ago. You know, the kind of information deluge there is, the kind of gadgets that are at the disposal of these children. So they are often living in a make believe world as well. So their social, uh, if I can say, lives online are far more obvious than the actual social uh, relationships they are able to establish, or I should say not able to establish. These are things that we see in school. So when we talk of care, compassion, and communication, I think it becomes imperative that we develop this culture in our schools more so now, because post COVID we all agree that the problems have escalated. Mental health issues have escalated, stress, anxiety, worry, children, not being able to cope with a lot of things, self-esteem and self-worth issues. There's so much of this going on. So every stakeholder, every counselor, every teacher, the school leadership, I think we need to first and foremost acknowledge that every child in the school matters, is important. And if that child is important, then the mental health and the well-being of that child really is important. Because we know science has proven that learning only happens uh, through when a child's mind is, or anyone's mind is at ease, Where what you learn with pleasure, you never forget. So there's a saying. So if a child is at ease and mentally healthy, then obviously they will perform well in academics and in other co-curricular activities. If they are stressed, it all starts showing up in various ways in their behavior, in their non-verbal behavior, in their performance or lack of performance in schools. There's so many indicators that the child is going through something. And I think what is important, as somebody very rightly said, the tools for identifying, the training that is required for not just the counselors, but for the teachers to be able to identify early on what kind of problems or who is facing what. And then, that personal connect, I think that is extremely important. So if the child feels heard, if the child feels that he can approach a teacher or a counselor, and there will be someone to address his problem, or even not address a problem, just hear him out, hear him or her out. I think that alone is a great stress reliever, because with nuclear families today, even children at home, they have hardly anyone to talk to. There are so many children we see who go back home and they just met with a lock. They unlock, enter, manage their own stuff, and there's no one to talk to or share stuff with. So I think parents are also under a lot of stress these days for various reasons. And then there are a whole lot of other factors. But I think by and large, what I would like to say that since the landscape has changed, we need to start addressing it in different ways.
Excellent. Very rightly put. And also the bridging the gap between what the counselor perceives in the school or what the wellness teacher nominated for the purpose perceives in a child like this, where there are doubts about certain stressors which are hidden away below the iceberg. And we get to know from certain patterns of interaction or lack of interaction or certain patterns of change in terms of withdrawn behavior, excessively
Yes.
shy. So I think we are very conversant with the fact that the school head's own viewpoint plays a very major role in trickling down the top-bottom approach for every teacher and therefore the help to the counselor. So the second question to you is, ma'am, going by this case where psychosomatic defenses have overplayed the role in bringing attention to the child, the somatization has played a major role in bringing timely attention, timely intervention. And I'm sure very briefly, Asta will tell us about the management plan for the help of the counselors here. But then do you think that we also need to get back to school heads and principals to help them understand the multiplying role, a very major role of counselors in being early detectors?
Absolutely, not just the counselors. I think that training of teachers and also the school leadership, as you very rightly mentioned. First of all, that that conviction in school leaders needs to be there that this is something that we cannot put in the back burner any longer. It is a pressing
Right.
problem. It's a pressing problem everywhere, and everyone has to be brought on board. And a lot of the counseling when it happens with children, we find, as in this case also that Astaji mentioned, that the parents were going through a separation, that the child was facing certain issues at home. And often we find, I mean, I think nowadays there are a lot of children who are coming from such families. Either there have been cases where children have either lost a parent, they're children of single parents, or they come from families where the parents are going through a divorce. This has become increasingly common, or there are conflicts at home, the child is witness to those conflicts and that verbal spat between parents, and that is extremely distressing for a child, and they're carrying all this baggage when they come to school, and obviously then this is being reflected in certain kinds of behavior. More often than not, these children are then, also disinterested in studies. They start falling back in studies. They get into
Right.
indisciplined behavior. They form part of a circle group of friends who are also like-minded, who are not interested in studies. And then then it's a downward spiral. So we need to I mean, as
Fair enough.
teachers, as heads, we need to be aware of such children, the behaviors they're exhibiting, and that they're, as you said, it's a call for help. So they need that one-on-one, interaction, definitely one-on-one talk to be able to understand what these children are going through. And I think a lot of these problems get resolved when you talk to the children, when the child knows he's being heard to compassionately, and there's a genuine interest and concern, then they open up. Otherwise they won't. They are able to sense that.
That's
And
precisely the reason why the 3C theme has been chosen as the
yes,
session, ma'am, the care, compassion, and communication.
yes.
Niti, ma'am, you had a comment to add, and we'll open the forum now, though we are started late today, but then we'll open the forum. There are a few questions. And Asta, ma'am, in the course of the comments and questions that come in, you can summarize in 2, 3 pointers the overall approach in terms of management of these children, because that's a huge, thousands of them, where bodily symptoms are a representation of the mental health conflict. Niti ma'am, over to you.
No, I think I had some very interesting question coming in from the
Right.
participants only. So what we can do, Asa ma'am can just wrap up the session and the presentation can go up, and then I'll also
Perfect.
pitch in and add to that.
Yeah, so ma'am, very briefly in about 5, 10 lines, to take back home and remember. This is how we raise our antennas and watch out where physical symptoms, bodily symptoms are a hallmark, not to
Okay.
miss out
Okay.
mind. Yeah.
Yeah.
We are unable to hear you, ma'am.
Basically, I was talking about somatization. I think be there who would not somatize at times when suppose we have had an argument with somebody, headaches happening, not wanting to eat food. So these are all forms of somatization. We also indulge in. But with children, when we are talking about clinical issues, yes, these symptoms, the frequency and the intensity of these symptoms is more, and it starts to interfere with their day-to-day functionality. What causes somatic symptoms? There could be many reasons, some continuing unresolved conflict, stress or challenge that a child has not been able to verbalize, excessive attention to bodily functions. Some children, they are very, very, touchy about, some little bit of pain here and there, and they can exaggerate that. So possible signs of an underlying illness, increased anxiety about good health. So these are possible, factors which may cause somatic symptoms in, children frequently. Quickly coming to, our school counselors. Of course, I think the focus is on school counselors, what all they can help children in need. Uh, First of all, they need to be very, very sensitive and very observant in, picking out the behaviors, any change in behaviors which normally they don't see, and they will rely on the feedback from the teachers who observe these children on a more regular basis. Then the counselors, they can do a wonderful job, and they are already doing in trying to bring together the different stakeholders, where they try to psychoeducate about the child's health, what are the changes that they have observed, and in which direction to move in. So they are the best advocates of students' needs, and they are that the agents which bridge this gap between the parents, the school management, and the students. So I think that is the best thing that school counselors can do, and they actually do. They are the leaders, advocates, and change agents within schools. So here in this particular case, how this case was approached is, I think, a very fine example of how the schools should approach these kind of cases. Teachers were extremely unbiased in their observation regarding the changes in the child's behavior. They were not critical of the child's lack of performance in academics. They tried to find out what could the possible reasons be before reaching to these kind of conclusions that the child is not studying, the child is distracted, and things like that. They were non-judgmental about their observations, and they referred the child to the school counselor timely, where the school counselor had a very impressive role. She had an understanding about the psychosomatic problems, and she put the dots together very quickly, and she took a thorough history and referred the case to a mental health professional by involving parents at the right stage. So this had the approach was a holistic approach where all the angles were covered and all the necessary steps were taken by understanding where actually the problem lies. So at the individual level, the child was taken for testing or assessment to rule in or rule out the kind of psychological problems the child was going through. Medical management was initiated. The child had to be started on some antidepressant medications also for a brief while. Therapy was started where the focus was primarily on enhancing the coping skills of the child, better communication because the somatization was happening as the child wasn't able to verbalize, emotional regulation, and helping her prepare for parent separation and addressing the associated concerns. What were her anxieties associated with the separation process? Working on and strengthening the academic deficits. So the teacher was, incorporated in trying to address what were the problem areas and helping the child address those issues. So this was happening at the individual level. At the family level, of course, the family was psychoeducated about the nature of problem the child was going through. It was difficult for the parents to accept that there was no medical issue underlying, as is the case with most of the parents. Interpersonal
Right, Asta ma'am,
communication.
I'll interrupt you because we have a little shortage of time. I'm sure we have few comments which will add on to the large, very holistic intervention plan you've suggested. There's no doubt to the fact that most of the multicentric studies in India also are saying more than 55% of children under 12 years have a lot of physical symptoms presented for their emotional and behavioral challenges. So undoubtedly, this is very important, and counselors are responding with a lot of positivity about such important case studies to be discussed in the future.
I would like to
We can,
conclude. I would like to conclude, sir. I would like to.
hello, yeah, ma'am.
I would like to. Sir, the head of the school was also extremely, sensitive in understanding the need to talk to parents about particular issue.
Of course.
The
So those who have
teachers were made aware about
any comments to add, our audience, kindly put in your question in
that
the
could be
chat
present
box
in the
and your
child,
comment. Anybody?
and it was.
I think we can take up the questions now, sir.
Yes.
It's time for that, and I would request Asta ma'am to just, not share the slide anymore so that we get a full coverage here. Okay.
Yeah,
What
Asta,
I will do-
we can have the slides put off now,
Right.
because you will have a couple of things to answer, and Poonam ji can add to it.
Right.
There
I'll
has
just pick up
been,
a
yeah.
question, sir, before we really
Ji,
start
ma'am.
off. Parminder Kaur, she has put up, at times the hardest part is to convince the parents that child is not faking. Kindly guide. So any of you can take this question.
Astaji, would you like to
Yeah,
or
Poonam
should
ma'am,
I?
would you like to?
Yes, yes. So I think again I'll pick up
Keep the
from the
answers very brief. Yeah.
yeah, I can pick up from the keyword communication. No? So if there are open lines of communication between the school and the parents, and they know that we are well-meaning, we are not there to pull up the parent or to criticize the parent or to create a story about a child. I think it's all the kind of relationship that schools build with the parent community that goes a long way in getting acceptance from the parents in what you communicate to them. And then finally they when they try to imbibe what the counselor has suggested or the school has, and it does show positive results, I think that faith and trust gets strengthened.
That's good. And I'll just put up a similar question that has come from Manisha Pathak. I think she's a counselor in one of the school. And a very nice case study she has put in. So I'll just like to put it. She says a ninth grade girl was sleeping in class and neglecting her work. Her parents noticed she had become withdrawn, eating less, sleeping more, no talking or rude to others, no interest in anything. In counseling, it was discovered that she had attempted self-harm. After her parents had fight because of some relationship issues and stopped her attending the dance classes to focus solely on academic, her condition worsened. Despite recommendations for medical help, they dismissed her behavior as drama. That's the main thing they're saying. And the school suspended her, and there were a lot of issues, and the counselor has to intervene and take up the things. I'll not read the entire thing which she has said, but what she wants to put in again is the same thing, that how, as a school counselor, when they are doing an early intervention, they reach out to the parents, but then the parents are not receptive to the idea that what the counselor is saying is the right thing, because they believe that they are the parents and they know better, and they are aware of the child. So this is something I think very very normal question which is coming from most of the queries that I am getting on the chat here. So I would really request any one of you to please answer.
Ma'am, I think the primary factor which continues to be overwhelmingly common is lack of sensitivity. And there is a across the board, there is a lack of sensitivity in the caretakers of children. And that sensitivity comes not by any intent. It is inadvertent, and also many times the communication that does not happen at the right time for the right
It's
purpose in the family
absolutely.
or in the
I think
school.
there's yeah,
Yeah, ma'am.
yeah. I think the communication is a huge issue. Today, children are unable to communicate freely without any kind of barriers with their children, they're unable to communicate often with the teachers in school. So unless there are people in their lives whom they can talk to freely and share, because when you actually sit down, I had a girl in my school, I still have that girl, who had was constantly indulging in self-harm, and I don't know how many hours of sessions one-on-one I had, my counselors had, and the teachers had. And I think it took a whole 2 years to get that girl settled down. And she did exceptionally well in her grade 10 board exam. She's settled now. There were issues at home. There were family issues. There was denial on the part of the parents. But you have to hear out the child. You cannot just pass a judgment, or you just can't throw that child out. You have to listen to them and hear them out. And I think they do open up over a period of time. It may not happen in the first go, second go, even third go, but when there's a constant effort to connect with the child, it requires time and effort. You have to invest time in the children, and but it does pay off in the end.
We have Dr.
And I
Preeti
think
Gulati
I
and
think
Tannu
it's very
Kapila.
important
They've
to
been raising their hand.
hold
Would you like to? Are you
oriented
not on the
sessions
video,
for
ma'am?
parents also.
Dr. Preeti or Tannu, ma'am?
Take care and then it
Please
is
go ahead.
half of the problem taken care of.
Good
Very
evening,
briefly.
dignitaries. This side, Dr. Preeti Gulati from Modern Convent School, Dwarka, New Delhi.
Ma'am, I think we have all agreed upon this in plenty of discussions. Let's have opinion from Asta ma'am for the time being. Asta ma'am, you've been involved in helping a lot of counselors and their army of peer educators. Has that been showing positive impact indicators? What is your experience? Has that helped in the school ethos and the climate?
Absolutely. I think training school counselors in peer education program or otherwise life skills or enriching counseling skills has gone a long way in them being able to identify the problems at an earlier stage and referring for intervention at an earlier stage. And it has overall not only worked wonderfully for prevention of going clinically wrong, but it has also worked wonderfully in ensuring the mental well-being of children in general. Like talking about the creative that can be of great help for children in expressing their problems or dealing with stresses, adopting them as a coping strategy, structured, effective coping strategy. So counselors have been able to go back to their schools and talk about it with the teachers and the management. And so it has, come up in a big way. So I have seen a massive change when we talk about, these kind of programs and how do they impact in a long-term fashion the overall environment of the school and in shaping the children's mental being.
Thank you, Asta ma'am. We have Neeti ma'am wanting to comment over here. Tanu ma'am, do you have a very specific question? Yeah, very quickly. We have other people waiting
Yes, sir.
also.
Yes, sir. I somehow believe that in today's world, time is rapidly changing. So, how many capacity building programs are essential for counselors and teachers to remain effective in their roles? And how can we practically implement these upgraded skills in alignment with national education policy?
Over to Neeti ma'am. I think ma'am will be able to give an answer to that.
No, come again, come again. What was your query?
Make it brief
Uh,
and very specific, ma'am.
yeah.
Yeah,
Tanu
what do
ma'am.
you really want to know?
Ma'am, I just want to know because time is changing, so we really need to upgrade our skills. I'm working as a school counselor in Access 41 for the past over 10 years, but we need to upgrade ourselves because we are dealing with the youth. So, how many capacity building programs are required, are essential to remain effective in our roles, and how can we practically implement these upgraded skills in alignment with the national education policy?
See, I'll tell you one thing which I always say. Counseling is not like any of your biology, maths, social science. There is no curricula, there is no yardstick of how you would do it, because you as a counselor should know there is a time when if there is a student who comes to you and you want to talk to a particular student, he or she might open up on the first day, or he or she might open up on the 40th day, or might not even tell you what you are saying. So it's a similar thing for all of you. It's a practice, it's a compassion, how much patience you have. Any amount of capacity building, I don't think would really suffice to your interactions, your things like that. So I personally, if you ask me, I'm not of the opinion that one shoe fits all. You can just be a psychology teacher, just student out of a graduate class, and you can be an excellent counselor. On the other end, there might be a possibility you might be into the system for 20 years, 30 years, but still you might not be that effective with today's generation Z or millennium or whatever you call it. So NEP talks about it, that's fine, but you have to keep equipping yourself. It's a medical field in a way, and every day is a new thing that is coming by, a new variant coming by, a new games are there, or some digital issues are there, or now we are also talking about substance abuses, and what is less, what is more, what is in thing, what is out thing. So my personal view is that it has to be this way, and you all are all experts. Any one of you can comment, or this Dr. Nagpal, I think, can bring it forward.
No, it is a great roller coaster journey, Tanu ma'am, and how many capacity building can be a very you know far-reaching question, because you cannot measure the number of sessions for a qualitative growth. It can be in one session, it can be 100 sessions, and people don't want to grow or come out of their comfort zones, isn't it? So I think it's a wonderful question that needs to be exercised on a periodical, regular basis. The whole purpose of this conclave is what? Today is the first session, and we see that there is no end to the questions and comments, and the house is full. It only shows the enthusiasm that is required for such topics, for waiting for ages to happen. So it's a wonderful initiative, and I think keep the queries, keep the concerns in the pocket, and there's so many sessions going to come. Participate more and more. And
So
today's
I'll just intervene. There is one question that each and every one of the partisans seems to be putting in, and I think it's a little tricky question, but I will just like to take it in the forum before we just end it. Similar thing, like a lot of people are asking how to inform the family and the parents, how to communicate that. Number two, and what are the counselor boundaries? And very very important question: to what extent a counselor can really take up his or her role in a school ecosystem. So if we can take these two last questions, and then we can really say the series will continue and we will move ahead. So from my side, I think these are the last two questions that we can really take up at the moment.
we have Dr. Nishant back to us, and maybe you would like to give a brief answer to the question here, sir. And very important one comment is coming about how to bring about the family's perception about abuse happening in the family. I think that's a topic we are going to take up in the next one or two sessions, and it is not an answer that would be sufficient for a minute or two. It's a plethora of areas and a Pandora's box which has so many dimensions. But for the question which Niti ma'am has just mentioned as a finale to today, Nishant sir and Asta ma'am, Poonam ma'am, let's go one by one, and all of you can give an answer to that. Sir,
Thank you, sir. So, there's no one line answer to when and how to break the news to the family members. See, this is very important that an adolescent also has some privacy issues. They always say, "हम बड़े हो गए हैं." Like, I don't want my things to be discussed in front of anyone, right? So, at one point of time, counselor has to maintain the privacy which an adolescent wants to be taken care of. But at the same time, it is a responsibility of the counselor to assess the severity of the problem. If at any given point of time, any counselor or any person, any therapist, any teacher has a significant or sufficient doubt to believe that the child may cause harm to himself or herself, or he might be a threat to the surroundings, they should clearly and directly involve the family members, in that thing. Because these days, as the times are changing, as somebody was talking about, self harm. So self harm has become very very common. Like children, they in the era of Instagram and like social media, these things are becoming very rampant, and you have to open your eyes to believe that these things are happening. If you think that my child is not doing it, the world is not doing it, then you are up for a trouble. So
Yeah.
my sincere request to all the counselors, all the therapists, all the teachers is that have a sufficient amount of doubt about the severity of the problem, and if you believe that there is some problem the child might have with, please go ahead and inform the family members. But if a child wants to discuss relationship issues, or some fight, or something of that sort, which you think can be a personal discussion, or an individual discussion, it is better not to. So it's like not a all in one phenomenon. It has to be decided upon case by case basis. Over to you, sir.
Absolutely. I think well taken. And the fact that approaching a child with very, very careful, sensitive communication has been the mantra from all three of you as panel team, and also ensuring that one cannot be judgmental at any point of time. And we tend to be looking at very easy conclusions drawn or inferences taken up. Even in the case presented today by Asta ma'am, I think the fact that physical symptoms are a dramatization or they are theatrical in nature. These are very commonly heard on the tables in the counselors' chambers and our chambers. I think we have to be getting into a jargon of sensitivity. Okay, Asa ma'am, your final opinion, maybe in 2 lines, and what is your suggestion after you see the messages coming in? What is your suggestion on what type of plethora of cases on priority should we take up? You both, Poonam ma'am and you. Yeah. I'm able to see a whole encyclopedia of suggestions coming in terms of the cases to be covered. And I feel, and thanks to Neeti ma'am and all the CBSE, I would say, think tank, especially Himanshu sir, for having agreed that this is a platform which was waiting for too long a time and years together. And now we see, look at messages coming from Doha, from Muscat. So this is an international program today. Thank you. Over to you,
Uh,
ma'am. Just a brief,
yes.
yeah, comment
Yes,
on.
I think when we talk about psyche, there are no boundaries. So when we talk about what all topics we can take up for discussion, I think they are endless, ranging from how to deal with parents to how to sensitize teachers to what is the role of principals, how to identify these kind of disturbances within classroom settings and what to do. So there are topics, innumerable topics that can be taken up for discussion. But as far as the role of counselors is concerned, of course, I think I use this acronym a lot. Uh, Being smart counselors, which is S is for being sensitive, M is for mindful, A is for being aware and updated, and R is for being receptive, and T is being a good, trainer, in the sense training others to be sensitive, training the teachers, and for timely intervention. So I think I use this acronym a lot, where the counselors can remember to be smart in the literal sense of the word and do what is needed. I think they're already doing a wonderful job, but when it comes to questions like what are the boundaries and what are the technicalities associated with the job of being a counselor, of course we can have a whole separate session for it. But as of now, I think Dr. Nishant has already highlighted that the boundaries need to be self harm or harm to others. And otherwise, just try and maintain the confidentiality and being receptive and responsive to the students.
See, Asa ma'am, I just recently myself and Neeti ma'am were discussing. Now, teachers in our country, including CBSE teachers, have an annual professional update criteria. They have a minimum, say, 50 hours of refresher training and reorientation and capacity building. Now, when you look at counselors, now if this can be a beginning point, the need for customizing the work of a counselor or the role and responsibility of a counselor to the setting of a school is not part of the agenda of their postgraduate degrees. Because when you work in a school, you're working with multiple stakeholders, including the support staff and the non-teaching staff also. When you look at the orientation to POXO, look at the orientation to PWD Act. So it's about school head, principal, teachers, parents, and non-teaching staff also. For that matter, every age of child is so different.
Yes,
You only mentioned, Nishant sir mentioned about from preschoolers to foundational years, middle school and high school. And one counselor, two counselors, say four counselors. If you are a luxury school, that's also not enough. So the customization, orientation, training, development, coming together, sharing ideas, I think this would serve as a expanding program. So that is
absolutely.
what I can sense, and I'm sure you all will agree partly or whatever. Poonam ma'am, your comment before we
So
ask Niti ma'am to
I'd
give
just
a
like to
conclusion.
end with, I'd like to end with just two suggestions, if I may. One is I have found in my span as a school head that if we encourage and nurture every child in at least one co-curricular activity based on that child's passion and interest
Right.
or talent that we might have identified, I think once their creative energies are focused in something constructive, then they are definitely steer away from, negative emotions, negative situation, no matter what the situation at home might be. It does to a great extent alleviate that. The second thing that I've found, which has really worked in our school, we have the kind of assemblies we have is very different to what other schools have. And I think, topics like social media, where students, they need this validation of, people liking them on social media. That is a part of their self-esteem. They think they're worthwhile only if they get that validation. So taking up
Correct.
topics like this, topics like body shaming, there's a lot of it happening amongst children. When you have sessions like discussions like this, I mean, literally, I have seen because it resonates with the children, everybody wants to stand up and share what they are going through or what probably somebody they know is going through. And just by listening to each other and by listening, and then of course with the guidance of counselors and teachers, how do we handle such things? It gives them a huge sort of perspective and a way forward in how to handle such situations without getting mentally or emotionally disturbed. I think that's a great way of addressing all the problems we find that children face. I think it's really worked in my school. We do a lot of that and it works.
Thank you, ma'am. Over to you, Niti ma'am. I think there's so much to carry home as information today. So many ideas new coming, but there's no doubt that the counselors conclave is here to stay. The launch has been fascinating, very encouraging, very inspiring. Thanks to the panel over here. Thanks to CBSE led by Niti ma'am here. A lot of ideas, we have noted them. And of course, definitely a case study approach with a macro beginning of every session, and a lot of participation from the audience as part of their learning will continue to be the part of the program in the fortnightly or 3 weekly approach. Thank you so much. Over to you, Niti ma'am, for the conclusion.
Thank you, Nakar sir, and definitely all the panelists. But more than that, I think a big thank you and a clap to all the participants. I think we had a house full. We didn't know what to do, how to get a panelist on the floor, because normally we have a WebEx medium which takes about 1000, and we were clocking 1012, 13 also. I don't know how. I won't call it a technical glitch, but that was a boon in some way or the other. But and definitely, Secretary Sir wanted to join in. He was traveling. He had been into an important meeting. He tried, but okay, he would really go through this video and the other, discussions that had taken place. More than anything else, I am still getting so many questions, so many suggestions on the chat. Believe me, I wanted to take each one of them, and not do any sort of a session, but just a Q&A, and all of you with me. What we'll do, sir, all
Yes,
these
ma'am.
questions that have come in, definitely all of you, we'll make it a note. And when we'll have the next series, we would have these questions also put up there. So we'll try to check out that whosoever has communicated to us and want some answers are given back those replies as we had promised. So not in this 1.5 hours of journey, but maybe when the next session we'll have, keep tuned and keep looking into our websites for the next session that we'll be talking about. And I'll just end it because it's already quite our past our regular time. At the end, there are three words which make me feel really good. That is care, compassion, and communication. So it's an apt title, and the entire session was about the care and the compassion, and definitely the communication with all the stakeholders that are involved in the social fabric of our systems. So thank you so much, and thank you from CBSC. And Himanshu sir, we'd like to have him again in the next one, and have a good interactive session with him also, because he loves interactive sessions. And I hope in the next conclave we'll try to have him not as a speaker, but as a person who can take the queries from the audience and from others. Thank you, all of you. Thank you, all the panelists here. And it
Thank you
was a
so much,
wonderful
ma'am.
session.
Thank you
Thank
so
Thank
you.
you.
much.
Thank you, everyone.